My name is Hezron Nambiro. I work for Kenya Red Cross as a program officer, currently supporting ECHO program in Samburu County, being supported by Finnish Red Cross and other partners like Ministry of Health, national government, and also county government of Samburu. The most urgent gaps that we really need to fill as Kenya Red Cross in a partnership with the ministry is the issue of access to vaccines in the sub-county that we are working in, that's Samburu North and Samburu East, and also this issue about myths and misconception. We are looking at being able to vaccinate 145,000 people or other persons in the county, and mostly people living with disabilities, people living with non-communicable diseases, and pregnant, breastfeeding mothers, the adolescents between 15 and 17 years. We've been able also to train our community health volunteers on campaign management aspect and also on COVID-19, on COVID vaccination aspect wholesomely. We've also been able to target and sensitize religious leaders, community leaders in the county. We will also sensitize media personnel. We had to bring together media personnel from different media houses, local media houses, and even the bloggers in the county to sensitize them about COVID-19. When we talk about the county government of Samburu, they are also running some of the medical outreaches. When they do medical outreaches, like to manage other medical conditions and even under 5 immunization, we also work together with them to integrate COVID-19 vaccination.
The current uptake of COVID-19 in Samburu County is actually low. We are at around 17.7% coverage, having vaccinated about 38,000 people out of a target of 184,000. We only have 4 approved vaccination sites. That is one in Samburu North, one in Samburu Central, and 2 sites in Samburu East. So looking at that number of vaccination sites, many people cannot be able to reach those sites because the county is very fast. Currently, Kenya Red Cross are supporting 2 sub-counties in COVID-19 vaccination.
The group that we are supposed to target, that's the elderly. They think that we are eradicating them. We want to kill them because they are no longer useful in the society. If you're going for an outreach and then you expect to over vaccine on that same day and you have not given information before, so the uptake will not be as much as we expect. Kenya Red Cross, apart from conducting outreaches, they have also helped us to undergo training of COVID vaccines. The skills that we have gained through this, the training that was offered by Kenya Red Cross personally, is the storage of this vaccination, the transportation of the vaccination. This vaccine is safe, it is effective.
We received the vaccine from the county DVI store and they are brought here. We also have the sub-county DVI store. When we receive the vaccine, we put them in the refrigerator and it should be at 2 + 2 to 8 degrees centigrade. There are classes of people that we don't give the vaccine, like the pregnant mothers in the first trimester, but in the second and third trimester we weigh the risks. So for the rest, we can give because it helps a lot to build the immunity. We only receive 2 types of vaccines. That's the JJ vaccine and the AstraZeneca vaccine. That's because of the storage. The temperatures of this area, they are very hot, so they are the only vaccines that we can store at the required temperature. And mostly the people prefer the JJ vaccine because it is only once. It is always good to come and take the vaccine because now one can travel, one can get in the crowded places, you can get that COVID-19.
In the church and wherever we go, we are preaching, telling people to go to receive vaccine. We have been telling people to observe the social distancing, to put on mask. Everybody has to receive vaccine. It is one way of protecting ourselves.